So sports medicine is one of those things that we've struggled with for a while, trying to appropriately brand ourselves and make sure we're adequately covering what we do. And it's hard because we don't just treat athletes. That's certainly a population that we do help with, but really we, in many ways, dabble in orthopedics with pretty much any non-operative musculoskeletal issue. We were really able to help. And then even outside of the musculoskeletal things, those athletic and exercise-related conditions, things such as concussion or helping to manage your diabetes while active. What do I do with my insulin, or do I need to supplement for my blood sugars to maintain my blood sugars, or whether I have exercise-induced bronchospasm, and how do I treat that? And so with our primary care background, we really have such a broad coverage and can hit almost every individual. Primary care sports medicine works hand in hand with our colleagues in orthopedics, neurosurgery, PMR, and if you were to draw the Venn diagram, most things we would overlap on. We're able to help most people that have back pain that are non-surgical. They don't have the red flag concerning findings. Over 95% of injuries are musculoskeletal injuries are non-surgical. So us and our orthopedic colleagues have a lot of overlap there. And we send a lot of patients back and forth. Once I've exhausted all the conservative things I can do, I send folks to the surgeon. But if they need help, they need ultrasound diagnostics, they think maybe it's their hip, but they're not sure, they can send them to us and we can do an injection in the hip using ultrasound. And so there's a lot of complementary medicine going on. PMR has a lot of the physical medicine rehabilitation. They have a lot of overlap as well. They help me specifically with like nerve testing, so nerve conduction tests, which I don't do, or certain pain procedures, injections of the spine, which I don't do. So we really have a good relationship, being able to pass patients back and forth for these different services. So with sports medicine, everyone thinks of the athlete as the patient to come, but we really have such a broad draw and demographic. And with my training in family medicine, and even before that with athletic training, and then into sports, really we see kids all the way up. And so toddlers all the way up to our high school and college athletes and beyond, into our middle-aged and even older geriatric patients. We're happy to help all along the way.